Have you ever noticed how some small habits might seem harmless but actually end up causing real trouble over time? Maybe you haven't thought much about what you do right after you urinate, but believe me, this is one of those little things that can quietly harm your prostate health if you're not careful. I'm glad you're here today because what we talk about will help you protect something very important, your prostate, and keep feeling strong and comfortable for years to come. So why does this matter, especially for those of us who are 60 and older? Well, as we age, our bodies naturally change, and the prostate can become a source of discomfort or health worries if we're not mindful. Problems like frequent urination, difficulty emptying the bladder, or that annoying urgency can all be signs of prostate trouble. The good news is, many of these issues are linked to habits we can change. Today, we're going to focus on one simple habit after urinating, something so easy to overlook, but that, over time, can really damage your prostate if done repeatedly. In this video, we'll talk about why this habit matters, what exactly happens inside your body when you do it, and I'll share practical, easy tips that anyone can follow. These changes might just save you from uncomfortable symptoms and help maintain your prostate health as you enjoy your golden years. So now picture this. You finish urinating, and then, before you move on, you do a little something extra. Maybe you think you're helping, maybe it just feels natural. But actually, that extra action could be putting pressure on your prostate and bladder in a way that causes damage bit by bit. It's like watering a plant, but instead of helping it grow, you're accidentally drenching the roots until they start to rot. Over time, this can lead to irritation, inflammation, and even worse in prostate enlargement. So, what is this habit? It's holding your urine for just a few seconds longer to finish up or applying extra pressure on your lower abdomen to squeeze out the last drops. Many men do this without realizing the strain it puts on their pelvic muscles and prostate gland. It might seem like you're making sure everything's emptied out, but actually, it can backfire. Why? Well, your bladder and prostate are connected in a delicate dance. The prostate surrounds the urethra, the tube urine passes through. When you push or hold urine longer than necessary, you're essentially forcing the prostate to compress that tube more than it should. That extra pressure can irritate the prostate gland over time and cause it to swell or become inflamed. This not only leads to discomfort, but also affects how well your bladder empties, creating a vicious cycle of problems.
This habit might have started because sometimes, after you finish urinating, you feel like there's still a little drip left. Maybe you worry that if you don't squeeze a bit, you'll get wet spots or feel embarrassed. Trust me, you're not alone. But here's a gentle reminder. Your body is built to do its job naturally. Urination is designed to be a smooth flow that finishes completely on its own. Trying to force it or hold it back is like interrupting a well-choreographed dance. It causes more harm than good. Now, I'm not saying you should rush off the toilet without being sure you're done. Taking your time is always wise. But what I'm asking is that you avoid pushing, straining, or holding your urine after you think you've finished. Let your body relax and trust the process. Let me share an example from one of my neighbors, Mr. Lewis, who's in his early 70s. He used to press down on his lower belly after urinating because he worried about leakage. At first, it seemed like a good idea. No wet spots, no worries. But after a while, he began feeling a burning sensation and more frequent urges to go, even at night. After a doctor's visit, he learned that this habit was irritating his prostate and making symptoms worse. With some simple advice, he stopped the pressure pushing, stayed hydrated, and gave his body time to empty naturally. Within weeks, his discomfort eased and he felt more in control again. This story shows that small adjustments make a big difference. It's not about rushing or forcing yourself, but about learning how to listen to your body and treat it gently. Another thing to consider is how your posture and breathing during and after urination can affect your pelvic muscles and prostate health. You might not realize it, but standing or sitting with tension in your belly or holding your breath while trying to finish up adds extra strain to your pelvic floor muscles. Over time, this tension can lead to muscle weakness or spasms, which again impact how well you empty your bladder and how comfortable your prostate feels.
Instead, focus on relaxing your whole body. Take a deep breath, sit or stand comfortably, and let your urine flow naturally. After you finish, give yourself a moment to relax without pushing or squeezing. This approach encourages your muscles to work the way they were designed to and protects your prostate from unnecessary stress. You might be wondering, what if I still feel like I'm not done? What if the drip keeps coming? That feeling is common, and it can be frustrating. Sometimes it's caused by an enlarged prostate or other conditions like prostatitis, but often it's worsened by the habits we're talking about. By avoiding pressure and trusting your body, many men find that this drip sensation reduces naturally over time. Also, remember that hydration plays a key role. Drinking plenty of water helps keep your urine diluted and your bladder healthy, making urination smoother and less irritating to your prostate. So don't be afraid to drink regularly, even if you worry about more frequent bathroom trips. The right balance is essential for keeping everything working well. Another practical tip is to make sure you empty your bladder regularly throughout the day, instead of waiting too long. Holding urine for extended periods can also stress your prostate and bladder, so listen to your body's signals and take breaks as needed. But when you do go, remember the most important advice here. Don't push or strain after you finish. As you get older, these little things add up. Protecting your prostate isn't about avoiding medical procedures or medications. It's about caring for your body daily through smart habits like these. Taking a moment to relax after urinating, letting your body empty naturally, and avoiding unnecessary pressure can make a significant difference in how you feel.
Now that we've talked about why pushing or holding urine after finishing can harm your prostate and how relaxing your body during and after urination helps, there's one more related habit we should discuss: wiping or cleaning after urination. How you do this can also affect your comfort and prostate health. Let's explore that next. When it comes to wiping or cleaning after urinating, it might seem like a small routine action, but the way you do it can actually have a big impact on your comfort and even on preventing irritation around your prostate area. Many men rush through this step or don't pay much attention, but gentle care here can help reduce inflammation and avoid infections that might add stress to your urinary system. First, let's talk about the kind of wipes or towels you use. Using harsh or scented tissues can irritate the sensitive skin around the urethra and perineal area. That's the region between the scrotum and anus. This irritation may not seem serious at first, but over time it can cause discomfort or even trigger mild inflammation that affects your urinary flow and how your prostate feels. So choose soft, unscented, and alcohol-free wipes or plain toilet paper without rough textures. Think of it as giving your skin a little gentle kindness every time you clean up. Also, try to avoid rubbing too hard or using excessive force when you wipe. Just a light, gentle pat is enough to stay clean. Over-aggressive wiping can cause tiny abrasions or redness, and that's the last thing you want near such a delicate area. Another important point is to make sure you're wiping from front to back, not back to front. This simple direction helps prevent bacteria from the anus moving toward the urinary tract, reducing the risk of infections like urinary tract infections or prostatitis, both of which can be painful and affect prostate health. Keeping the area clean and dry also matters a lot. Moisture can encourage bacterial growth and skin irritation. After wiping, if possible, you might want to gently air dry or use a clean, soft cloth to pat the area dry. Wearing breathable cotton underwear instead of tight synthetic fabrics can help keep things fresh and comfortable throughout the day. Now, moving from hygiene to hydration, it might surprise you how closely these two things work together. Drinking enough water isn't just about feeling good or avoiding dehydration. Proper hydration actually helps keep your urine less concentrated, which means it's less irritating to the bladder and urethra. When your urine is very concentrated, it can burn or cause discomfort, and that irritation can extend to the prostate.
But here's where many get confused. Some think that drinking less water means fewer trips to the bathroom and less strain on the prostate. That's a common misconception. Holding back on fluids actually does more harm than good. When urine stays in the bladder too long, it becomes a breeding ground for bacteria and increases pressure inside the bladder, which puts extra strain on the prostate gland. So it's better to drink regularly throughout the day and empty your bladder when you feel the need. It also helps to avoid drinks that irritate the bladder and prostate. Caffeine, alcohol, and spicy foods can sometimes cause urinary urgency or discomfort, especially for men with sensitive prostates. If you notice these drinks make your symptoms worse, it might be worth cutting back or timing their consumption earlier in the day. Another common habit to examine is how you sit or stand when you urinate. Many men have a preferred way, but some positions can put extra pressure on the pelvic area or make it harder to empty the bladder fully. For example, if you stand rigidly with your stomach muscles tight, you may be unintentionally squeezing your bladder or prostate, causing discomfort or incomplete emptying. Try relaxing your abdominal muscles and standing or sitting comfortably. Take your time and avoid rushing. Sometimes sitting down to urinate, even if you're used to standing, can help your bladder relax and empty more completely. This simple change can reduce leftover urine in the bladder, which otherwise irritates the prostate and increases the chance of infections or inflammation. If you're someone who frequently wakes up at night to urinate, these habits become even more important. Nighttime bathroom trips are common after 60. But excessive or strained urination during the night can worsen prostate symptoms and disturb your sleep. Staying well hydrated during the day and avoiding fluids close to bedtime can help reduce this. Also, by practicing gentle and relaxed urination habits as we've discussed, you can make those nighttime trips easier and less irritating. Let me share another story that might sound familiar. My friend George, who's 65, was dealing with frequent nighttime urination. He used to rush every trip to the bathroom and often pushed hard to finish quickly so he could get back to bed. Over time, this habit caused him more discomfort and even some mild urinary leakage. After learning about how pressure and rushing affect the prostate, he switched to sitting down, relaxing his belly, and avoiding pushing or straining. He also adjusted his hydration schedule. After a few weeks, his symptoms eased and he even started sleeping better. These examples show how simple, thoughtful changes in daily habits can protect your prostate and improve your overall quality of life. It's not about dramatic fixes or expensive treatments. It's about listening to your body and treating it with care, especially as it changes with age. You might be wondering, what if I'm already experiencing prostate discomfort or symptoms like frequent urination, weak flow, or urgency? Are these habits still helpful? Absolutely yes. These small steps are often the first and easiest way to reduce irritation and improve your symptoms. Of course, if symptoms persist or worsen, it's important to see your healthcare provider. But adopting good habits supports any treatment you receive and might even reduce the need for medications or procedures. Before we finish, one more thing to consider is the role of pelvic floor exercises, sometimes called Kegel exercises. These can help strengthen the muscles that support your bladder and prostate, improving control and reducing urgency or leakage. But remember, when you do these exercises, avoid holding your breath or straining, as that can cause more harm than good. A gentle approach works best, just like the relaxed urination habits we talked about. By combining all these ideas, avoiding pressure after urinating, gentle cleaning, proper hydration, relaxed posture, and pelvic floor care, you give your prostate the best chance to stay healthy and comfortable. Now, as we wrap up our conversation, there's one more habit that's surprisingly common but can really impact prostate health: ignoring your body's natural signals to urinate. Sometimes, especially as we get older, it's tempting to hold off going to the bathroom, maybe because we're busy, or we don't want to disrupt our routine, or even just out of habit. But holding your urine too long is actually one of the biggest stressors on your bladder and prostate. Think of your bladder like a balloon. When you hold urine for too long, you're stretching that balloon more than it's meant to stretch. This overstretching makes the bladder muscles weak over time, which means it doesn't empty as well. That leftover urine puts pressure on your prostate, causing irritation and inflammation. Eventually, this can lead to symptoms like urgency, frequent trips to the bathroom, or that frustrating feeling of never fully emptying your bladder.
So the key is to listen to your body. When you feel the urge, try not to wait too long. Give yourself permission to take a break, get to the bathroom, and let your body do its job naturally. It may feel inconvenient at times, but your prostate and bladder will thank you for it. Another important reminder is to stay active. Movement might not seem connected to urination habits, but staying physically active improves blood flow and muscle tone throughout your pelvic area. This means your bladder and prostate muscles stay stronger and more resilient. Gentle activities like walking, stretching, or even light yoga can make a difference. Plus, staying active helps you maintain a healthy weight, which is important because excess weight around your abdomen can add pressure to your bladder and prostate, making symptoms worse. And finally, don't forget about regular checkups. Even if you're feeling well, getting your prostate checked by a healthcare professional can catch any issues early before they become serious. These visits give you a chance to talk about any symptoms you might be hesitant to mention and get personalized advice. Remember, protecting your prostate isn't about drastic changes or complicated treatments. It's about small, consistent habits like letting go gently after you urinate, cleaning carefully, staying hydrated, relaxing your body, listening to your bladder's signals, staying active, and seeking support when needed. Each step you take is a step toward feeling better, living more comfortably, and enjoying the independence and energy that make your life rich and full. If you've tried any of these tips or have your own experiences managing prostate health, I'd love to hear from you. Sharing your story might help others who are going through the same things. And if you found this video helpful, please like it and subscribe to the channel for more practical health advice designed especially for seniors like you. Here's to living your best life at any age, strong, comfortable, and confident. Take care of yourself, and I'll see you in the next video.